am Asheesh Thomas Matthew. I am an IT auditor and I am from Bahrain. I came down to Bangalore to meet my parents. I came for holidays to spend time with them. For some months, I've been having one condition. Like I've been facing tremors in my fingers. When I use the phone or when I use the laptop, I have my fingers get fidgety. They start moving a lot. And I told this to my parents, and my relations were also there. And when they saw this, they said that, okay, why don't you consult a neurologist, to get a better opinion. So I asked them, okay, which hospital to go to, and they had a very high opinion of SPARSH, which is nearby. And from what we heard, that SPARSH has a very good neuro team, and that got me to visit SPARSH.
When Asheesh first walked to my OPD with full smiles, came in casually and hardly had any complaints.
So the doctor had suggested some tests to put my concerns to rest, and he suggested MRI and CT scan. And I underwent both MRI and CT scan there at SPARSH, and the results did not come immediately. It takes some time. So he told me to come after a couple of days. And I returned home hoping and praying, thinking that it's not something that I'm worried about. It should be something mild, and it should be something, most likely some anxiety attack, something like that. Some medication related work can work this out.
But when we investigated and found him to have an AVM, very deadly condition, which if not treated would mean he's sitting with a time bomb in the brain and has a risk to life at any moment.
A couple of days later, I returned to SPARSH to collect the results. I collected the results, and then I went and met Dr. Murali Mohan, and he showed me this, and he said that it's not like I had told him that I think I have Parkinson's. Okay, but he said, don't worry, you don't have Parkinson's, but there is a finding, you have something called an AVM. Then he told me what AVM is all about, long-term consequences of having AVM, and the impact, he told me, could be hemorrhage. And he told me that the only solution for this is there is no medicine, there's no treatment, only surgery. You need to remove it, and only by removal you can be free of this. So he said, go home, discuss with your family, and come back.
It was a devastating news for him, but I love the courage this man has. He did his homework, came back the next time and spoke to me about it.
So the next day, we went to SPARSH and we met the neuro team. We met Dr. Avinash and Dr. Murali. And Dr. Murali took a piece of paper, and like a child, like explained to a child, he explained to us what is AVM. He drew the head, the brain, and what is the situation, condition. And he said where it is in my body, in my head, where it is. And he told me there is nothing to worry about it.
Whenever there's a shunting of an artery into a vein with a leash of vessels in between, you have an AVM. These AVMs have very high blood flow. They steal the blood flow from the neighboring area. And Asheesh had one such high flow AVM.
Surgery is something, it is, cutting your body, right? And where they actually go inside. So this is something to be worried about. And we were really nervous, but the SPARSH team was really confident. When we heard their knowledge and their expertise, we understood that they know what they're talking, and this team can do it. And this was really very important for us to calm us down and to remove the nervousness from us.
So as decided, we opted for the surgery, and the doctors gave a lot of support and confidence that things are going to be fine. But as laymen, we always have the feeling that it's an operation, it's a surgery, okay, and it's not just arm or leg. It's the brain. It's the most important part of your body. So that was always inside me. I was supporting him. I said it's going to be fine, but inside me, the pain, what I went through, it is so real. I can't put it in words. But the doctors stood beside me. They gave me confidence, and they moved him to the surgery. It was a 22-hour surgery, okay, and it was pretty big.
22 hours of battle, blood loss. I should thank my wonderful team, Dr. Deepa, Dr. Avinash, Sister Ginny, Dr. Rupa, Sister Neelaveni, and every single soul in the OT never thought about themselves. They were there through this battle of 22 hours.
For us, we had tensing moments in our lives. It is a day that we cannot forget. And during the 22 hours, I must say the sisters there, they had made us know the situation that was going on inside, and we were at ease. We were always told that things are under control.
And ultimately, God has blessed us with the good results that we see Asheesh today back to life with full of life.
After the surgery, I was more involved in asking the doctors how his recovery is going to be. And as the doctors said, It was a slow recovery, but now, after the surgery, he is fine, totally fine. He's able to do his basic activities, his normal day to day routine. He's able to work, he's attending meetings, everything. And special mention to Sister Nilaveni. She took a lot of care. She came out and spoke during the surgery. She used to come out and speak to me that things are fine. And a lot of sisters more after the post op, especially in the ICU, I must say, Sister Parvati, Sister Suchi, Sister Priya, all these people were like angels, because once my husband was unconscious in the ICU, I couldn't go and meet him. But to know his condition, they were the only way. So they always made sure that they come and speak to me, they reassure that things are going to be fine.
And opting to do this surgery at SPARSH Hennur was the best decision I and my family made.